Welcome back to Movement Project PT. Tim Rementer, Doctor of Physical Therapy, and today we're going to find out if your thoracic spine is really what's at the cause of your shoulder pain. Watch to the end of the video so you can find out which thoracic spine movement is your problem, along with treatments to help alleviate the pain. Rotator cuff pain involves way more than your rotator cuff. And today we're going to talk about one of those main drivers, one of those main inputs is your thoracic spine. I can't tell you how many times I've had patients that are either scheduled for surgery or have had a multitude of injections and medications without relief. And we see them 2 or 3 times focusing on the thoracic spine, and their pain is 50% less, sometimes even eliminated, just by getting that spine and shoulder blade to rotate out of the way so the rotator cuff has room to move. The thoracic spine is so important for the shoulder because without it, we're not able to get that rotator cuff and that shoulder blade in the right position for overhead movement. So when I go to flex my arm, the spine needs to extend, and more details which we'll get into on each movement. If we take a look at each of the main movements of the shoulder, we're going to go ahead and correlate it with a movement of the thoracic spine and explain why it's so important, and then follow that up with exercises for each. So when we take shoulder flexion, which is the most commonly used movement because of all the reaching we do, we're looking to go overhead, and then when we do that, the thoracic spine needs to extend or bend backward. Without it, if I round forward and I'm stuck in this position, this kyphosis we call it, I can't lift my arm any more than that. As soon as I extend, I'm able to get much more range of motion. So extension is key for shoulder flexion. If you have pain in the flexion, most likely your problem is that your thoracic spine is not extended enough.
Let's work on improving our extension mobility. First off, we're going to use a lacrosse ball or tennis ball, place it on the segments of the spine that you want to address, and then move that arm into that desired motion, which in this case is shoulder flexion. Once you get to that end range, I want you to take a deep breath, inhale and exhale, because that's what's really going to give you ownership of the range of motion. If you cannot breathe in a new stretched out position, your nervous system will never take full ownership over the range. So just make sure once you get to that end range, take a deep breath in, 2 to 3 seconds, hold, and then exhale fully, and do that for each repetition. Moving into an active thoracic extension and strengthening movement, get the back at the wall, try to flex fully using that new stretched out range of motion from your thoracic spine. To take it one step further, you can sit, which will lock your lumbar spine.
Now, if we talk about abduction, that's moving the arm out to the side. When we go that direction, now we're asking the thoracic spine and the ribs to side bend. So when we bring that arm up, that spine needs to move sideways. If it cannot, it's going to result in restrictions. And then again, that rotator cuff ends up being the tissue that gets irritated.
Here we're going to work on that side bending range of motion. In this case, I'm trying to improve my spine's ability to bend to the left. So I get on my right side and press up onto the right forearm. Again, doing that deep breathing to make sure the ribs and spine are stretching further, and I'm owning that range of motion. To go to the next level, I bring that top leg and move it into a locked position. That's going to further bend that spine. Again, doing my deep breaths to get ownership of that range. Try to do some for each direction to keep symmetry. If you want to take it to the next level, you can extend that arm going onto the hand rather than propping onto your forearm. But of course, make sure there's no pain with any of these stretches. If there is, go back to the prior level or reach out to your movement specialist for more specific treatment. Follow the stretching by bringing your posture and back against the wall, keeping contact with your wrist and forearms as you move into abduction. For 10 repetitions, being sure to take a deep breath at the top range of motion for each of the repetitions. Another less aggressive version of the side bending stretch is to do it from seated, starting off with your arms crossed on your chest. Again, trying to do the deep breath at the end range of motion. The next level to this would be to bring the arm overhead, which is going to further open up your rib cage, elongating the muscles and the ligaments of the spine and ribs.
When we talk about crossing the midline, then we're asking that thoracic spine to rotate. So you can see when we cross, we need this right side to rotate to the left, and then we need the left side to rotate to the left as well. The movements are contrary though, and then when we reach across to the right, our left side of our spine needs to rotate to the right.
If you find rotation is what's most limiting, follow this mobility series to improve your range of motion and help your shoulder pain. You're going to start by placing that same ball on your ribs and spine area, and then go through that cross body range of motion, taking a deep breath at end range. Keep working your way up and down the spine until you get each of the segments as loose as needed and you feel like your range of motion improves. You can take this rotation, range of motion stretching to the next level by locking your pelvis, bringing your hip up toward your chest, and then go through range of motion into rotation, bringing your back and shoulder blade toward the floor. Of course, once you're at that end range, again, take a deep breath to gain ownership of that motion. Actively, we can begin strengthening that rotation by lying on our stomach, hand behind the head, actively rotating, lifting that chest and shoulder blade off the floor. Another option is to get into a hands and knees position. Again, hand behind the head, opening up that chest by rotating the thoracic spine until you feel a stretch. And again, at end range, doing that deep breath, taking the rib cage through as much range of motion as possible.
Remember, if you're not subscribed to my channel and you want to help me cut out unnecessary surgery, please share this information with as many people as possible and subscribe to the channel.
Next, we have a standing active rotation stretch. To use that new range of motion, you can place one arm against the wall and then open up that thoracic spine. Your chest should move along with the shoulder. No pain should be felt through the range. Take a deep breath at the end range of motion. Inhale and exhale, and then work through repetitions with both the right foot forward and the left foot forward in a staggered stance. Switch directions to work the opposite rotation, spending more time on the side that you find to be most restricted.
Another motion that's really difficult for people with shoulder problems is reaching behind the back. That's going to require that thoracic spine to flex so I can reach and extend my shoulder. And it's also going to require a little bit of side bending and rotation at the same time. And then for me to be able to rotate backward, again, that spine needs to extend and go through a little bit of rotation as well.
For the shoulder rotation mobility series, place your ball on that thoracic segment and rib area and take the arm through that external rotation range of motion and then internal rotation range of motion, spending more time focusing on whatever your most painful or most restricted range of motion is, being careful not to agitate or irritate the tissue in the shoulder. Do 10 repetitions, making sure to breathe in deeply, inhale and exhale at your end range for each direction.
Hopefully you learned how your thoracic spine is a main driver of shoulder pain and a few things you can do to help it. Make sure you subscribe to my channel to help me cut out unnecessary surgery. Remember, if you want to feel, perform, and live your best, you've got to move your best. Keep it moving.